Imagine a drug that has scientists around the world excited, divided, and intrigued, a compound that could slow aging, improve health span, and potentially extend life, yet comes with controversy and caution. That drug is rapamycin, a compound originally discovered in soil bacteria on Easter Island, and it's considered one of the most powerful interventions in longevity research. Today, we're diving deep into the science behind rapamycin, exploring its mechanisms, benefits, controversies, and what studies reveal about its potential to transform aging. All backed by real, peer-reviewed research from top institutions. Rapamycin was initially discovered as an antifungal agent, but quickly caught attention for its immunosuppressive properties. Doctors used it to prevent organ transplant rejection, but scientists noticed another remarkable effect in animal studies. Rapamycin consistently extended lifespan across multiple species, including yeast, worms, flies, and mice. These findings sparked intense interest in aging research, because rapamycin targets a pathway called mTOR, mechanistic target of rapamycin, a central regulator of growth, metabolism, and cellular repair. The mTOR pathway is crucial for understanding rapamycin's impact. In simple terms, mTOR controls how cells respond to nutrients, energy, and growth signals. When mTOR is overactive, it promotes cellular aging, inflammation, and metabolic dysfunction. By inhibiting mTOR, rapamycin slows down processes linked to aging, enhances autophagy, the body's cellular recycling system, and reduces age-related damage. This makes it a powerful candidate for extending health span and lifespan. Animal studies have produced striking results. In mice, rapamycin supplementation increased median and maximum lifespan by up to 30 to 40%, even when started late in life. It also improved cognitive function, cardiovascular health, and muscle strength. Notably, it reversed some signs of immune aging, enhancing the ability to respond to infections and vaccinations. These findings suggest that rapamycin does not just prolong life, it improves the quality of life during aging. However, rapamycin is not without controversy. Its immunosuppressive effects, when used at high doses, can increase infection risk and impair wound healing. This has led to debates about the risk-benefit balance of using rapamycin in humans for longevity purposes. Researchers are now exploring low-dose or intermittent regimens, aiming to maximize anti-aging benefits while minimizing side effects. Early clinical trials in humans show promise, but the long-term safety and optimal dosing strategies remain under investigation. One of the most exciting aspects of rapamycin is its ability to activate autophagy, the body's natural cellular cleanup system. Autophagy removes damaged proteins, mitochondria, and other cellular debris, preventing accumulation of age-related damage. Inhibition of mTOR by rapamycin enhances autophagy, promoting cellular rejuvenation and resilience. Scientists believe this mechanism is central to the drug's longevity-promoting effects. Rapamycin also interacts with metabolic health. Overactive mTOR is linked to insulin resistance, obesity, and cardiovascular disease. By modulating this pathway, rapamycin can improve insulin sensitivity, reduce inflammation, and support healthier metabolic function. Studies in older adults and animal models show improvements in glucose tolerance, lipid profiles, and energy efficiency, highlighting rapamycin's multi-system benefits. Cognitive aging is another area of interest. Neurodegenerative diseases like Alzheimer's and Parkinson's are influenced by accumulation of damaged proteins and mitochondrial dysfunction. Rapamycin's mTOR inhibition and autophagy activation help clear these toxic proteins and maintain neuronal health. Animal studies demonstrate improved memory, learning, and reduced neurodegeneration, suggesting potential applications in preserving brain function during aging. Inflammation, often called inflammaging, is another target of rapamycin. Chronic low-grade inflammation accelerates aging and contributes to multiple diseases. Rapamycin has been shown to reduce pro-inflammatory signaling, helping create a cellular environment conducive to repair, regeneration, and longevity. By modulating these fundamental aging processes, rapamycin positions itself as a unique, multi-target longevity intervention. Despite its promise, there are key limitations and controversies. Rapamycin can cause mild side effects, including mouth ulcers, digestive disturbances, and changes in lipid metabolism. Long-term effects in humans remain incompletely understood, and its use as a longevity supplement is still explored. Researchers emphasize that current knowledge is based on animal studies and limited human trials, making caution essential. The emotional and practical perspective is important. Rapamycin represents both hope and caution. It offers the potential to extend health span, improve cellular resilience, and counteract age-related diseases, but it's not yet a guaranteed solution for humans. It exemplifies the frontier of longevity, science where cutting-edge research meets ethical and practical considerations, requiring informed, evidence-based decisions. Researchers are now investigating combinatory approaches. Pairing rapamycin with lifestyle interventions like intermittent fasting, exercise, and optimal nutrition. These strategies may enhance benefits while reducing risks, mimicking the multi-system effects observed in animals and aiming for real-world human application. Early trials suggest that short-term or pulse dosing may provide anti-aging benefits without the full immunosuppressive burden. One of the most intriguing aspects of rapamycin is its ability to extend lifespan even when started late in life. Unlike many interventions that need to begin in youth, rapamycin shows benefits in older animals, suggesting that it can reverse or slow some aging processes even after decades of life. This distinguishes it from other strategies and positions it as a promising tool for adults seeking longevity interventions. Rapamycin also raises philosophical and ethical questions. Should we use drugs to extend lifespan? How do we weigh potential risks against the promise of longer, healthier life? These discussions are active in the scientific community, highlighting that longevity is not just a biological challenge, but a societal and personal one as well. In conclusion, rapamycin is a powerful and controversial candidate for human longevity. Its effects on mTOR, autophagy, metabolic health, inflammation, and cognition make it one of the most compelling interventions discovered in decades. While animal studies show dramatic improvements in lifespan and healthspan, human trials are still in early stages. The key takeaway is that rapamycin represents both promise and caution, offering a glimpse of what may soon become a central tool in anti-aging medicine. For now, the future of rapamycin in human longevity depends on further clinical research, careful dosing, and individualized medical guidance. It exemplifies the frontier of science where the dream of living longer, healthier lives is becoming a real, evidence-based possibility.